Welcome to COIQ, a first-of-its-kind video program about health innovators, early adopters, and influencers, and their stories about riding the roller coaster of healthcare innovation. I'm your host, Dr. Roxy, founder of Legacy DNA Marketing Group, and it's time to raise our COIQ. Welcome back to the show, COIQ listeners. Today, I have Paulo Machado with me, and he is a 20-year veteran, tons of experience launching and commercializing healthcare innovations, and we're going to get his take on why some healthcare innovations succeed and why some fail, and he's also going to share some strategies of how you can overcome and beat the odds of success and maximize your ROI. So welcome to the show, Paulo.
Roxy, thank you very much for having me. Looking forward to having the conversation with you.
Absolutely. So for our listeners who don't know you just yet, tell us a little bit about your background and what you're doing these days.
Sure. Started off my career in the financial world, managed a couple of trade investments at Salomon Brothers, shifted into the healthcare space, worked in pharmaceuticals for a number of years. And then in 2008, went ahead and decided to start up my own consulting practice, focusing in on product development and design, business model development and design, and help organizations of every sort of this, across the spectrum, from payers and providers to retailers to emerging tech companies and VCs, figure out how to basically develop innovations that are going to have a positive impact on our healthcare delivery system, and more importantly, on the health and well-being of individuals.
That's great. One of the things that I think is really interesting about having your perspective on the show is you've worked both internal and in the nuances of that, and then you've also worked as an external consultant. And so I think that kind of gives you a multi-leveled perspective to bring to our audience.
Absolutely. Cut my teeth on the entrepreneurial side. Excuse me. Starting off in the financial world, I was always a person who was very intrigued by large-scale innovation projects in the organization, even back in the financial services days when we were launching new business units in Asia and Latin America, and follow that through when I was in the pharmaceutical world, launching new business models, new products, excuse me, in the U.S. and abroad.
Awesome. So the first question that I have for you is, how would you describe riding the roller coaster of healthcare innovation?
Wow. That's a broad question. How would you describe it? I think it really depends on the individual. For some people, absolutely terrifying. Other people, it's incredibly exhilarating.
Yep.
And everything in between. So it depends on where you are in the ride. Getting ready for the moment of anticipation when there's the big drop.
Yep.
You just feeling relieved that you made it through the drop.
Mm-hmm.
So it really is dependent on your framework, your experience set, and the amount of dopamine rush that you enjoy the process.
Yeah, and I think, entrepreneurism is not for the faint of heart. So we probably have quite a few listeners that have high levels of dopamine that find, the wild ride pretty exhilarating.
I bet that's the case.
Yeah. So one of the stats I talk about often, and you and I have talked about as well, is this failure rate, this alarming statistic that 95% of innovations that are brought to market fail to reach any adequate level of acceptance or profitability. So I'd love to get your take on it. Why do you think some healthcare innovations succeed and why some fail?
Wide range of reasons. Sometimes let's kind of start with the basics. Understanding the marketplace and really truly understanding the need. There's quite a few people who have been entering into the marketplace in healthcare, and I've been involved in healthcare innovation for about 20 years now across the spectrum with payers and providers. I'm helping consumers figure out what their needs are, so to speak. Mm-hmm. And healthcare isn't a normal good. It's frankly what I think of as a negative good. It's not something that most people want to seek and consume. It's a wide range of things a lot of people have avoidance around. And it is it's a system, so to speak, that's been designed for fee-for-service historically, and we're in the process of transforming from that to be much more focused on value-based care. And what happens is with this massive healthcare system that exists, in quotes, is that basically people come into it making, I guess, oversimplifying the problems, mm-hmm. and trying to come up with very specific point solutions. But that point solution sits within a larger ecosystem, and addressing a specific issue may not be enough. And there's a tremendous amount of behavioral change that needs to go. So software is not the solution in every case. Frankly, frequently it's not the solution. It's just an enabler. And people come in and look at it as, oh, that's a simple problem. We can make that happen. But the real challenge ends up being on, because it is not a normal good and you can't always go direct to consumer effectively with health and well-being, behavior modification, it's the system. And it's very hard to have systemic level change with simple software point solutions. So you see a lot of organizations come in not understanding what is involved in making significant change. That's not to say that you can't make money solving a small problem and selling it to another organization is going to make it part of their broader offering. But quite frequently, I think what ends up happening is, in my experience in being out there working with startups for well over a decade now, is they fail to estimate truly the adoption rates and the inertia in the system that exists. The piloting and the testing and the proof that needs to be developed before it becomes something that's readily adopted. We don't have a system, so to speak. It's not like you make one decision somewhere and everybody just adopts it. If you want to sell something to hospitals, you have thousands of hospitals you have to go convince. If you want to sell to insurers, you have hundreds of insurers you want to convince. If you want to sell to doctors, forget it.
Yep.
Massive sales force to go out there and convince one doc at a time. And if you want to sell consumers, even more challenging, because you have to sell to consumers in the context of how their decision-making fits in the context of all the other stakeholders involved. So I think there's a massive, overly optimistic estimates around how adoption will look and the effort it takes. It's not just building the solution, it's then getting it to be adopted. Even if it's the best solution, I've seen some unbelievably amazing solutions. Just the adoption just takes too long and they run out of money.
Mm-hmm. So what kind of conversations do you normally have with those innovators to kind of help balance this optimistic enthusiasm that's really like fuel to keep on going with this reality that we all live with?
Yeah, I think that's a great question, because I think the reality is you don't want to squash the optimism, because as you said, that is the fuel that's going to keep people going through the night. And I think what ends up happening is you need to really get people to focus on the system, what is involved, and really try to understand what is the problem you're trying to solve, and not just what's happening with that user, but every layer surrounding that user. So over time, what you end up seeing, if it's direct to consumer, if it's a product that consumer has to use, how does that affect the doctors that are surrounding that consumer? If you're trying to get, for instance, a weight management program out there, which there are many companies that are doing that, or diabetes management, how does that fit in the ecosystem of all the stakeholders who are also trying to get that same consumer to do something similar? So a typical diabetic has, a wellness company reaching out to them. They have their insurer reaching out to them. They have an employer program of some sort. They have their insurance company reaching out. They have their doctor reaching out. They can be doing something on their own. So there's just a barrage of solutions being thrown at them. And as a consumer, that creates confusion, and it's not a great experience. Mm-hmm. So helping people think about and design solutions that are not just product-focused development and design work, but business model development and design work, and understanding how it fits and how those two interact, I think really ups the likelihood they're going to be successful, because they're going to understand the business model and the context for which those specific point solutions are existing. And of course, the last piece is financially, who pays for this stuff? Because quite frequently what happens is there's this lack of understanding around the basic issue of most products in the normal world, in the non-healthcare world. If I'm going to buy a phone, I'm the person who decides what that phone is. I'm paying for that phone, and I'm also the user of that phone. So all three of those primary functions sit in one person. And frequently in healthcare, those three decision points, those three roles exist in different stakeholders with misaligned financial incentives. So understanding who's going to pay for it, who's going to decide what gets used, and who's actually going to use it are three very different issues that need to be addressed. And you have to think about that when you're doing the product design and figuring out how the cash flows through the system. So it's not just the user experience, but it's the financial flows, it's the operational flows, who has to touch it, and it's the information flows, who has to be aware of what's happening.
Yeah, I mean, you touched on it. It's a multi-sided market that I think adds a layer of complexity and difficulty, to commercialization. And I find, like you, that this is something that healthcare innovators really struggle with. Is even just looking at a business model canvas and really mapping that successfully with all market sides of the equation, taken into consideration.
Yeah, I think it's important to keep in mind it's being aware of all these sides and tackling the ones that you can tackle. Mm-hmm. Have enough success to then say, okay, I can now go raise some capital, or I can go from a pilot to a scaled program for a phase one kind of launch with an organization, and just iterate and learn and continue. And failing, by the way, isn't necessarily a bad thing. There's a tremendous amount to be learned from failing.
Sure.
More from success in many ways, shapes, and forms. But I think you can just kind of keep that continuously evolving, iterating, and keeping your eye on the bigger picture of what am I doing, how is it affecting other stakeholders, and who's going to be blocking me. So if I'm launching whatever, a diabetes management program of some sort, am I fighting that patient's, if I'm going direct to consumer and through his employer or whatever channel or insurer, is that something that's at odds with the program that his doctor has him trying to do? And what's the there? How do you overcome that challenge?
Mm-hmm. So when you're working with a healthcare innovator, where do you normally start in that sequence of decision making? Of course, it's going to vary to a certain degree of where they are in that commercialization or launch process. But what have you found to be best practices around that decision tree that has to be made?
Yeah, I think it's great question. And typically I refer back to the business model canvas and value prop canvas and kind of walk them through what is their understanding, what they're actually trying to solve for. And do they understand what's happening at the market level? Do they understand the value proposition that's involved at the various stakeholder levels, and see where they may be missing something, and not considering that there's some, maybe they're not considering where the money's coming from, or how difficult it will be to get somebody who pays for something to buy in, not just a consumer to use. If the consumer wants to use and the payer doesn't want to pay, you're going to have a problem, right? We've seen those happen frequently in the marketplace. That all being said, what's fascinating now, that I've been doing this for a very long time, is the market's evolved tremendously. It has become much more mature about its self-awareness. And you talk to these organizations that have these various roles of providing care or paying for care, and the convergence of those two, because you're seeing a lot more pay-buyers out in the marketplace and going much more vertical stack on driving implementation. They're trying to get rid of the friction from the system at the provider, payer, and consumer level. And you're seeing much more maturity in terms of how these organizations are thinking about the problem more holistically. But they'll admit to you that our processes, because of issues of safety and security of data, and really being focused on a quality product that's behind their brand. Because remember, these are large organizations and they have brands, and they just can't necessarily shoot from the hip and not worry about failing, because they have to worry about failing. It affects their brand. They're cautious, and they'll tell you it'll take 3, 6 months, 9 months, a year and a half before a program can get to a point of scaling. Just going through all of the hurdles they put there for good reasons. But typically you need a large war chest. This is where and the maturation, by the way, also I'm thinking about the investor community. If you think back, 10, 15 years ago when I started getting involved in this marketplace, the investors just were not aware of what's going on. And there was just a lot of money thrown, just ideas. And then they realized, wait a minute, this is like taking 2 years until we get any kind of revenue out of this. What happened? It's a tech play, right? How come it's not flipping me at 20x in 18 months?
Right.
Revenue in 18 months, huh? What happened? But I think that has changed dramatically. The majority of investors I engage with are very aware of what's happening in the market. They understand the hurdles. That being said, they having lost their shirts on quite a few of those 95% fail.
Yep.
There's quite a bit more what I'll call risk intolerance. Because they're looking for much more evidence that things are working before they throw money behind it, and there's less true risk capital in the marketplace. So it's interesting to watch the dichotomy and the evolution and maturity of the market.
depending on what type of innovation you're bringing to market, you could be talking about a clinical trial, you could be talking about, some pilot studies. We've talked about this before, this whole idea of death by pilot and kind of getting stuck in pilot purgatory. When you're working with innovators, kind of share some insights with our audience of, what do they need to look for or to be mindful of when they are first negotiating that pilot agreement to make sure that they get the success or the results that they're looking for at the end.
Yeah. So that's an unbelievably important series of decisions that need to be made. And frankly, choosing the wrong pilots, it really depends on how desperate you are and what your war chest and run rate looks like, of course.
Yeah.
But if you have some time, picking the right first pilot or two are absolutely essential. And frequently you'll find people just don't think through what it's going to take and what the hurdles will be to get those first couple pilots up and running. They'll just do any pilot, and that first pilot literally will crush them. They won't be able to do anything else, and they'll go under trying to get one pilot done. So having the right pilot partners for the first is absolutely critical, and just asking the right questions around alignment of expectations, timing, resources, roles, communications, cash is involved. Frequently you'll see multi-billion-dollar organizations want to do a pilot with a tiny company, and they're basically saying, I don't want to pay anything. That's really painful for an organization that has very limited capital to not at least have their cost covered. In a situation like that. And it's also a proof point to investors, and these guys aren't even willing to pay for a pilot, much less a scale. So it just becomes challenging. So I'm going through a checklist of questions and having very open communications. I'm also very into creating a significant alignment around the fact that where you are in your life cycle with the product. Are you in co-creation mode and you're looking for the high stakes gamblers and people who thrive and want to do that co-creation with you, and that's part of their ethos? Or are they an organization that only does pilots and they're later adopters? They're not really running a pilot, they're running a first stage of something that's already proven. So really
a feel-good program.
Absolutely. And that's okay. You want to, it's a different kind of pilot. It's not a co-creation pilot. In that case, it's just kicking the tires between that organization that's risk averse and the specifics that I may need to the minutia within my program I may need to fine tune to fit your organization. That's more of a customization of onboarding a program versus a pilot. A true pilot in my mind is when you're not sure what the results are. You have a hypothesis you want to test. You found somebody who wants to test it with you, and they're literally going to learn from this with you, and they're in for that. So understanding what it is that we're actually doing together in a true pilot is critical. If you're just basically saying, hey, I've now proven this, I've got white papers and everything else, I want to do a pilot, I don't think of that as a pilot, right? In that case, all you're doing is customizing the program before you go full launch. Yep,
absolutely. One of the things kind of, taping off of what you said was that, a lot of times health innovators think that, I'll just use Cleveland Clinic, for example. Cleveland Clinic said yes to my pilot. Like that's like the holy grail. And I think that sometimes, it seems as though that might be the right pilot because of the brand recognition. It kind of gives you some kudos that you might be able to put on your website and, your pitch deck and whatnot. But, in the conversations that I've had and in my experience, that can actually be a death sentence. And it's not Cleveland Clinic per se, but it's more of, some of the more prominent, bigger organizations that can be just a real resource drain, kind of like you described. And I might have more success with some of the smaller no-name entities. What are your thoughts about that?
Yeah, I clearly branding matters. If you're going to go out and throw some of the big brands that are out there in the healthcare system, in the healthcare world, and say we did a pilot with XYZ and somehow you survived the gauntlet of getting it done with it.
Right.
Everybody knows what that means. That doesn't mean you can't hit a lot of singles and doubles with organizations that have a higher risk tolerance and appetite and frankly can move a lot faster, and they're more focused on co-creation with you. Not that the large organizations can't have that co-creation mindset. It just takes a lot longer typically, in my experience, to go from, we had the first conversation, so we get a result that's then marketable somewhere else. And working with those organizations, frankly, they also are very savvy as it relates to, well, do I really want to launch this and get this to be in my competitor's hands? And it brings up more complexity in the design of the pilots, exclusivity and things of that sort start to get kicked into the conversations, which again, it can be very enticing for somebody who's coming out of the gate when they hear a big brand say, hey, would you consider being exclusive with me? Not thinking, okay, well, what does that really mean from a pragmatic? And by the way, a lot of this is just not really relevant if you're talking about people who've been around the block and built organizations and experienced this themselves, and they're coming back for a second or third tour of duty. In that case, basically startups in healthcare is like mainlining crack for these people.
Right.
They're addicted to it and they can't stop, even though it's an incredibly painful process, because there are a lot of rewards. You're helping people, right? And it makes a big difference. And that's what I find is incredibly rewarding for innovation in healthcare. You're seeing a much larger influx of people into healthcare than, say, 10, 12 years ago into the innovative side and building organizations up from scratch that were not in healthcare before. And they didn't have purpose behind the innovation they had before. So what you find in healthcare is people come in and they talk to me about, this is so different than my old job. My old job, I was doing X, Y, Z, and I went home and it didn't really matter. And here people feel like they're on a mission. And if you'll notice, quite a few organizations they're innovating is because they had a personal thing that occurred in their life. And they're driven and fueled by, wow, that shouldn't be that way. Is there something I could do? Mm-hmm. That just doesn't happen in most other industries.
Yeah. I think you're so right. So kind of speak to, let's say you had three recommendations or suggestions around strategies or tactics, best practices or lessons that you've learned along the way.
Number one is find the right people to go on this adventure with. So team is absolutely critical. These are the people you're going to have to trust. You're going to spend more time with these people than anybody else in those early years of getting this up and running. So alignment of values, alignment of vision, alignment of everything that matters that relates to working with somebody. Can you have fun together? Can you be serious together? Can you work towards common goals and objectives? Because if this is happening internally, there's conflict internally, it just dramatically reduces the likelihood of success, right? So that's one. Have a great bunch of co-founders and initial small pot of people who are on a mission together. The second is really be really clear and aligned on what's your initial mission out of the block, and make sure the whole team gets it. You understand the problem, the scope of it, how large is the market potential, what are the issues you're trying to address in the marketplace, understanding who's addressing those issues now, who are the blockers, who's the direct competition trying to solve it now versus those who are going to just block it by their inertia and being in the marketplace, and what you're doing affects them. And just being very clear on that component of it. And frankly, not being stuck to it, because the reality is once you get in, you're going to learn that, hey, that's not really exactly what we thought it was going to be. How do I pivot? So being willing to have that curiosity and being mindful of the fact that we may not have the right hypotheses we're testing in the marketplace, and pivoting and getting out there.
I just want to pause for a second, because I think that is a huge point. And we just cannot share that message frequently enough, that we kind of really have to let go of our static point of view and position around who, what, how, when, and why, if we want to be able to have a successful business. A lot of times people ask me, why do you think that failure rate is so high? And I think what you just described is one of those top reasons.
It's interesting. I always think of, we're so okay with minimum viable products and iterating around the product level, but at the company, team, and other levels, individual level, we struggle with that as a concept. Based on our cognitive biases on what we know is true. But if it's not working, then how do you pivot it and still remain true to your values, right? But if you are causing harm with your iterations, you have to kind of make that trade-off. So ideally, you're going to have a positive impact on the healthcare system and the delivery system and everything else that needs to be addressed. And you're not going to just pivot to a place that's not good. not
Right,
healthy.
right. Yeah. Some of the things that I think you're describing really to me kind of bleed outside of what we might think of as like commercialization strategy and go to market strategy, and really kind of bleed into more like the leadership realm and discipline. And, I think that's something too that sometimes I come across innovators that think about like, oh, well, that's like a phase 3 thing, like I can't focus on building my culture and, communicating values and mission right now. Like I really just need to get this off the ground, and I need to, get those first customers, and really not understanding that the culture is being created, whether they do it intentionally or not. Right.
Oh, if the culture is created to your point, by design or not by design, by default. And along the issue of culture, it's also not just your internal team, but how do you pick the right external partners and customers? Because there's quite a few organizations that you can get wrapped up in that aren't aligned necessarily with where your values are. And that's really important. All customers are not the same. And it really makes a difference.
Yeah, that kind of makes me think of, that idea of, are we a fit? And, again, kind of like what you were talking about before, I'm an innovator. I'm an early stage company. I'm so hungry. Everyone seems like it's a fit. And instead of really having like that criteria of, kind of like the first date scenario, is this partner, is this, customer, are they really a fit for our organization, and being willing to say no?
Yeah. And it obviously easy to say. The reality is it totally depends on how well resourced you are. You're going to get a lot more desperate if you haven't found the right partner or customer after a year and you've got 6 months of burn rate left. Right?
Sure.
I just got a bunch of money and I got 2 years to go. So you can be, a little bit more discerning.
Sure.
But I think you just keeping it in the back of your mind and just making sure you understand the trade-offs. Because these clients can take the product down a path that you don't want it to go.
Yep. Absolutely.
It's also a very big risk, just making sure that the clients don't take the product to a place you're not comfortable taking it to.
Yeah, absolutely. Where it's just overdeveloped and that particular customer loves it, but it's not viable for anyone else.
Yeah, and I think just having a clear strategy, where are we heading, and understanding how the tactics build and building metrics to show that these tactics are the right ones, because sometimes we have a hypothesis these metrics are the right ones that show them heading in the right direction strategically, and the reality is they may not be. Mm-hmm. Not being stuck with the metrics that you have in place, because some of them may not be the right indicators. They may be correlated to success, but may not be causally linked to success of a company.
Sure. Yeah, absolutely. So we were talking about lessons learned, and you shared 2 of them with us. What's the third one that you want to share with our audience?
Yeah, the other is just being really aware, self-aware of yourself and the founding team. How long do you want to be in the game? Like, what is your real objective? Are you looking to build a company and flip it? And knowing yourself well enough to not have the ego in place where I have to take this from beginning to end. Because it's understanding, what's my role in this? Am I the idea person? Am I the guy who gets the team together? Am I the guy who gets the funding? Am I the guy who's going to see it all the way through to IPO? And frequently what you find is people hang on too long. To roles that they shouldn't have, and the ego gets in the way, so to speak. And just understanding, what is my role in all of this? What am I trying to accomplish? Am I trying to build a big company? Is this a lifestyle company? Is this company that's something I want to start and go all the way through IPO? And just being very clear with yourself and checking in with yourself and saying, okay, am I limiting the success of this organization? And I see some founders are great at stepping into different roles as things evolve. Other times it's a real battle, and it really truly impedes the progress of organizations. So what I call self-reflection, self-awareness, and understanding that your role may need to evolve as organizational needs evolve. Building having a 10-person startup is not the same as scaling to a 1,000-person company. It's different skill sets, different experiences, and things of that sort.
Yeah, absolutely. I think that's a real hard one.
Oh, brutal. Because very few people, in my experience, have the self-awareness of where they fit in and where their skill sets are. And many will believe that you can take it all the way through. Very few can have the skills that are broad enough to do all of it.
Right. Right. Yep. Absolutely. Well, thank you so much, Paulo, for sharing your wisdom with us today. For those of our listeners that want to maybe get a hold of you, that have some additional questions for you, what's the best way that they can reach out to you?
Yeah, LinkedIn, Paulo J. Machado is probably the easiest place to find me. Email address is pmachado66@gmail.com.
Awesome. Well, thank you so much. Until next time.
Thank you, Roxy, for taking the time out. Be well.
You got it. Be well. What's the difference between launching and commercializing a healthcare innovation? Many people will launch a new product. Few will commercialize it. To learn the difference between launch and commercialization and to watch past episodes of the show, head to our video show page at drroxy.com. Thanks so much for watching and listening to the show. You can subscribe to the latest episodes on your favorite podcast app, like Apple Podcasts and Spotify, or subscribe to the video episodes on our YouTube channel. No matter the platform, just search COIQ with Dr. Roxy. Until next time, let's raise our COIQ.